This is episode 22, titled Psychology to Eastern Medicine with Mikaila Cameron, subtitled Acupuncture Saved My Life. This is John Beethan, the producer of the show, and I had a few comments before we get into the talk with Lisa and Mikaila. One thing that became obvious to me this morning, this is the 22nd show we've done, and in most every single case, all 22 shows really have healthcare practitioners that walk the talk. And in most cases, these people have had their own health issues and turned to some sort of alternative healing to heal themselves, and got them into a career as a healthcare practitioner doing the same for others. Every single show we do have some gems in them. Take time to heal, or the healing will take time. Now for the show.
Welcome back. This is Lisa Thorpe, and this is Health and Wellness Encinitas. And in case you're trying to find us, you can always search Encinitas in your podcast app. Today, we have Mikaila Cameron with Gentle Acu Wellness. Mikaila, thank you so much for coming over from Poway to join us today. It's an honor to have you. Welcome, and why don't you go ahead and share about what you do?
Thank you. It's an honor to be here. Thank you for having me. I'm a licensed acupuncturist, herbalist, occupational therapist, and I provide personalized one-to-one Chinese medical evaluation and treatment of people with a multitude of issues that they're concerned about. I focus on internal medicine, musculoskeletal situations, emotional situations, people who have unexplained edema, swelling in different parts of their body, but all of their medical labs are coming out normal. So I really work on things that Western medical-wise, things are great. The person's labs are perfect, and yet they don't feel well. And so my job is to figure out what the root of the issue is, why the person doesn't feel well, through a very in-depth evaluation and questioning, looking at the tongue, feeling the abdomen, feeling the pulses. You get a big picture and you make an educated hypothesis about what's going on to help people feel better.
And that's all part of an acupuncturist discipline, is that correct?
Correct.
But you also have two other degrees. Your other degrees are, I believe, psychology and occupational therapy.
Yes.
So how did you come along this path and decide to go into acupuncture?
As a child, I always wanted to help people. That was my mission. I wanted to work in prevention, and I wanted to work in something that was deeply meaningful and that would impact people very positively and in a gentle way. And psychology was my first path because I thought, well, if you can figure out what's going on in a person's emotional mind and in their interpersonal relations and help them to heal that and to have stronger relationships, that would help a person in a very profound way and help them be happy and listen to things that maybe other people couldn't listen to the hard things and help people through that and help people through the hard issues. And I did that at Kennedy Krieger Institute, Johns Hopkins in the inner city of Baltimore for 4 years. And it was really hard, very rewarding work helping with people. We worked with the worst cases. People would pull off their skin, they would pull toilets out of walls, they would destroy property. And our mission was to help people learn how to get their needs met and to express their feelings in ways that were nonviolent and that were positive to get what they needed. And we did that in a non-aversive, a nonviolent frame of reference. And I love that. I needed to be a part of something that helped to address very difficult issues in a very positive way, and we had a very high success rate 100% of the people we worked with got better.
What do you think was the magic?
It was the one-on-one. We did a lot of in-depth questioning. We looked at the behavior. We looked at everything that went before the behavior. We looked at everything that came after the behavior. And we figured out with the people who knew the person the best, with the person and with our education, trying to figure out what the motivation for that behavior was. And a lot of times it was just paying attention.
They just needed
to be seen and heard. Sometimes it was boredom. Sometimes it was communication, not being able to fully communicate what they wanted to get what they wanted.
So you were like a sleuth.
Yeah.
Having to investigate what was really... And it sounds like that's carried over because, again, you're investigating what is at the root cause. So how from psychology then did you go into occupational therapy?
Well, when I was working in psychology, I saw the occupational therapists working. And it looked like they were playing, and their patients were laughing.
Nice.
And they were having a lot of fun. It was very lighthearted. I thought, wow, to profoundly help someone in a very lighthearted, fun way, that sounds fabulous. That sounds like a good marriage and medicine, because occupational therapists are psychology majors. And I had an occupational therapist working with me, helping a child who had feeding issues, and I was amazed by her breadth of knowledge. And we had some kids who would pull off their skin, scratch their skin off, and I thought, I wonder if it's a sensory experience. I wonder if they're getting endorphins from scratching their skin, or if the environment is so irritating that they're doing it as a stress relief. And the psychologist, the top psychologist, thought I was crazy, and she laughed at me. But in OT school, I learned there is a frame of reference for that, sensory integration. A lot of people have sensory integration issues at different levels, and I learned how to treat sensory integration issues through occupational therapy.
And how long were you in occupational therapy?
I went through another 4-year program for occupational therapy, and I've been doing it for 18 years. I'm still an occupational therapist.
You don't look old enough to have all these degrees.
Thank you very much.
You must be doing something right.
Clean living.
Yeah, that's good. That's good.
Genetics.
Yeah. Nature and nurture.
Yeah.
Awesome. So do you feel that also there might have been, now with your acupuncture background, do you look back on some of those cases and see where maybe there might have been nutritional, or in addition, what do you think some of those cases might have been?
Oh, it all goes together. Yeah. I worked with severely mentally ill people in one of my rotations for acupuncture school. And in 3 months, everyone was acting, quote-unquote, normal. Everyone was feeling much better. And what we found with those people who we were helping, there was a lot of heat that was stored in the body that wasn't getting out. A lot of us have less than optimal health, and when our health is less than optimal, it's difficult to release the heat from the body, and we call it harassing the heart, fog the mind. And if you help the body release that heat, people can feel so much better. And another issue we found was blood stagnation. The blood wasn't moving well enough in the person's body. If you lift up your tongue, and if you see dark purple veins underneath your tongue, that's one indication that the blood in your body is stagnating, and it's important to get that moving for your health. So I think it's a myriad of issues for people, and I think if we can put all the disciplines together, I think people can expect more profound results and not be stigmatized, because a lot of times behavior is physiological.
Sure. Mm-hmm. Sure. So now bring us from psychology, occupational therapy. How did you choose acupuncture?
Well, in OT school, through all of my school, I worked full-time through all of my degrees and put myself through school. And I got mono in OT school. And I became very ill, and the doctors told me to quit the program or I'd end up in the hospital. And I didn't quit the program. I just studied with the book on my chest, and I asked my teacher if I could put my head down during class and just look at my book with my head on my desk, and she agreed. And in one of my medical appointments, I had another issue. My lungs weren't quite clearing up after a cold, and I told my doctor, and he said, "Sorry, make another appointment for another 5 minutes, another copay." And I was so disappointed. I was so frustrated because money was tight, time was tight, and the last thing I could do was make another appointment. And I spoke to a psychology mentor of mine, and she said, "Have you ever heard of Chinese medicine? I think they might take time with patients and really look at the deep underpinnings of what's going on. You might want to look into that." And so I rented a PBS special from the library and listened to an audio tape of Chinese medicine, and I fell in love. I was enamored with how the physicians spent a whole hour with their patients and really got to know them, and to hear all the different things that people were living with that acupuncture helped. I wanted to be a part of that. I thought, wow, wouldn't that be amazing? I realized that doctors are under a lot of stress, and I have friends who are doctors and nurses who are really frustrated. They only get 5 minutes with a patient, and it's really stressful to work under those conditions.
And have limited tools.
They do have limited tools, and I thought I would like to be a part of that, where I have the luxury to spend a whole hour with the patient one-on-one and really get to know them, see them across their lifetime, and really be able to figure out what's going on underneath everything.
And amazingly, you have this background of being able to look at them for them psychologically and then occupationally. So it's I think people are very fortunate to come and do an evaluation with you.
Thank you.
Yeah.
Thank you. It feels like I've been building up my whole life tools so that in midlife I can help people.
Do you think that the history of acupuncture is communicated in society today? Do you think most people understand it?
I don't think they understand it fully. As enamored I was by the PBS special, I didn't fully understand it. I would look and try to understand it, and I had a very limited knowledge of Chinese medicine and all it had to offer. I just kept hearing about the gate pain theory and how it was great for pain and musculoskeletal, but I really didn't understand just how deep a medicine it was.
It's ancient medicine.
It's ancient. It's
right?
5,000 years old.
And are there different categories within Chinese medicine? Obviously, there's acupuncture, and then there are the different modalities within it. Maybe you can help all of us to understand a little bit more about Chinese medicine and acupuncture.
Yeah, Chinese medicine encompasses acupuncture, herbology, Moxibustion, cupping, tuina, nutrition therapy, exercise, body mechanics. That's all in our scope of practice. In school, we learn all the physical therapy tests for musculoskeletal, which I didn't learn all of the physical therapy tests in OT school, so it made me a better OT off bat. We learn about nutrition. We have pharmaceutical classes. We have Western doctors come in and teach us how to do history and physical. We learn how to listen to the heart, look into the ears, and then we learn about how the energy of herbs help people heal, all their different temperatures and all the different channels they flow in and all the different contraindications. And we learn about all the acupuncture points. There's over 360 of them. We have to know everyone intimately. We don't know what they're going to ask on the boards, and the boards are very tough. But a person who goes to a Chinese medicine physician, practitioner, can expect a lot of tools that they can be helped with. They can receive acupuncture, and there's different styles. I do a very gentle style where I barely put it under the skin, and there is research to support that. If you just touch the acupuncture point with the needle, even barely, I can even put it on top of the skin and get results. If people are needle phobic, I didn't care for needles, and I thought it was weird the first time I got acupuncture, seeing all these needles stick out of me.
And was that for the mono?
Oh, it was after the mono. I got this chronic fatigue, I thought, but I wasn't going to put that label on myself. And I went to acupuncture to help my energy, and it helped me. And I also went for a condition where I'd been struggling with it since my 20s, so it was 15 years. I had the condition. Doctors told me I needed surgery. There was no cure. I had to keep getting multiple surgeries, and I wasn't going to put myself through that. I went to Chinese medicine when I was in school, and I had weekly acupuncture for 6 months and took herbs every day for 6 months, and I was cured. I got hate letters from my doctor saying, "You're going to die. You have to go our route." But I was cured through Eastern medicine without surgery, just with herbs and acupuncture.
It's amazing that the doctors would send you angry letters. It's unfortunate.
I think it's maybe just to cover yourself. It was one lady.
Well, and they do. I mean, I've said this before. It's I think we can never blame the doctors because they're liable.
They are.
They're liable. So they have to adhere to the letter of their training, which is relatively limited. Not to say that it doesn't have vast capabilities in and of itself, but it is limited. And if they don't adhere to that, or if they recommend or allow something outside of that, they're liable if something goes wrong.
I really respect Western medicine and what it has to offer, and I enjoy being the medicine that can fill in the cracks.
Right.
And that can address things that don't seem to be a problem, but they are a problem. And then people have a better quality of life.
And you collaborate with Western medicine now.
Yes. And I'm always looking for open-minded doctors who want to collaborate. I've given a lot of research articles to older doctors who think it's kind of cute and interesting that I'm doing this cute little medicine, but not really taken seriously all the time. So, and I'm sure there are older doctors who are open-minded that I haven't met yet, but I'm always open to that.
And there is a lot of research. I noticed on your website you've got a number of links. What can you make reference to some of the research that you use?
There's research from Helene Langevin from 2001, and she looked at what happens when you put a needle into a person's body and when you twist the needle. And what she found was we know there's connective tissue right under the fascia, and she found that the connective tissue winds around the needle and it sends physiological messages to other parts of the body. And there's been studies that have shown, well, you can see the acupuncture points on MRI, and the acupuncture points have an electrical potential, and you can measure those different electrical potentials. And when you put a needle into a point and twist it, we're not quite sure how the body gets the physiological messages, but it does, and it listens, and the body heals itself.
The body does that. I really believe that this is the best kept secret that everybody really needs to know about the body and about wellness. And it is that exactly what you just said, that the body heals itself.
Mm-hmm. It does.
Every night we go to sleep, the body's regenerating itself, and the body is healing itself. And if it's given correct support, it will autocorrect. Mm-hmm. And everything is energy. That's my other, like you're talking about it. It is energy. Mm-hmm. Those points, those channels, those meridians, they do exist. And on a even more focused level, everything is energy, and it's mostly just positive and negative charges, right? With tons of space in between. Mm-hmm. And it's totally changing all the time. So it's one of the things I always say is it's like whatever's going on, for sure it's going to change. Mm-hmm. And how you support the body is what determines if it's going to change for the better or change for the worse. Mm-hmm. So I love it talking about acupuncture and things that bring to light and support the fact that everything is energy, and this is how the body actually does heal itself. Yeah,
it's about supporting, listening to the body, and taking it seriously. We know that acupuncture channels parallel the circulatory system, the lymphatic system, And so when you put a needle in, it sends messages to all your different systems, whatever's needed. But you're making very scientific, it's an art. You use your intuition, you use all your book knowledge, and you use what you feel when you're working with a person, and you see them get better, so then you know you're doing the right thing.
Do you get trained in the use of intuition in acupuncture school?
We take Qigong classes, and so that we learn how to Tai Chi Qigong. We learn how to generate energy and feel energy and be more sensitive to energy. And we're trained in how to ground ourselves and to be fully present for each person when they're before us, so that we can really listen and we can really feel what's going on. And some people couldn't feel a thing, and some people naturally, feel energy and feel things. And they said, that's okay. Just keep on the path, and your intuition will deepen, and you'll be able to feel and be aware of more and more things. And my intuition and my sensitivity to energy just keeps blossoming year after year. More things open up, just tools to help people. And then you're just thankful for that blessing.
And do you feel like that's in the moment that you're working with somebody, an idea or a thought or a word or a direction comes to you?
It's in the moment.
Yeah.
Always. Sometimes I hear points in my head, and I double check myself because
like spleen 6 or
yeah. I hear a point prescription in my head for that person.
It just comes to you.
It just comes to me, and then I double check myself because I'm a perfectionist, and I like to make sure I'm doing the right thing scientifically as well. But my intuition, it's right. I do study for each patient too. On the weekend, I'll study and make sure I'm doing the best thing for that person. Just reevaluating what I'm doing. And
so when somebody comes,
thriving.
when somebody comes to you, they go through a pretty comprehensive evaluation. It sounds like, as you said, it's about an hour. What is the average program? Or, I know you'd mentioned when you first experienced acupuncture, you did 6 months of herbs and needling. Is that about what people can expect, or what can people expect to go through?
Everyone's so different. It's difficult to put an expectation. If someone's really weak, if they have something that they've been struggling with for a while, some people say it's 1 month for each year. Mm-hmm. What I notice is, my intention for my patients is always for them to find the maximal results in the least amount of time. And that's what my mentors trained us in school too. They said, you want to get the best results in the least amount of time. You don't want people to be dependent on you. Just get them feeling good and get them out the door, and you'll be provided for. You're doing the right thing. So that's always my intention. So in occupational therapy and in acupuncture, I'm always amazed at the rapidity of the healing process. The human body always surprises me in a good way.
It wants to heal.
It wants to heal.
Yeah.
You just need to support it and love it and listen to it.
That's great. I always ask guests for their number one wellness tip. That sounds like it might have been yours, but I'm going to go ahead and ask it now to see if it's something different. What if you were to give people one thing for them to take away that's like your number one health tip, what would it be?
The most valuable tip that I can give to people is go to bed before 11 o'clock at night.
Oh, good one. Yeah. And that gets back to, when does the body heal itself, right?
At night.
And
11 o'clock is gallbladder time.
Gallbladder.
The gallbladder is the decision maker in our body, psychologically and physiologically. The organs listen to the gallbladder and depend on the gallbladder. So if we can rest and let the blood just relax and let the body heal itself, if we're asleep by 11, so go to bed a little bit before 11, so that you're
in bed by 10, so you're asleep by 11.
And then you'll feel so much better.
I do.
Me too.
It is all the difference.
It's amazing. Yeah, a lot of times people think they have chronic fatigue and they just need to go to bed before 11. I have a friend who was in her 50s. She would dance till 5 o'clock in the morning, ballroom dancing. And she said, Mikaila, I think I have chronic fatigue. And I said, when are you going to bed? 5 in the morning. But I sleep 8 hours. I said, that doesn't matter. Just try. Think about going to bed before 11 and see what happens. She did it. And she said, oh my goodness, I don't have chronic fatigue. I just had the wrong bedtime.
Well, she was chronically fatigued because she was staying up late.
Dancing through the night.
Good for her. It's a good problem to have, I think.
Yeah.
So you spoke about your own experience of mono and how it led you down this path. I'm curious, and this is another thing I always ask everybody, is there something else that you feel was a pivotal moment in your life?
There's been so many pivotal moments. Mm-hmm. I've learned that near-death experiences really open your intuition. I've always been a very intuitive person, and I've had quite a few near-death experiences.
Quite a few. I was thinking you were going to say one. How many near-death experiences?
Oh, I haven't counted them. But
okay, you're freaking me out a little bit. No, you've got to. Now you've got to.
I think there's someone watching out over me. Oh,
obviously.
I always have known that there's someone looking out for me, and I was supposed to do something, grow spiritually, and do something big in this lifetime because I've been kept alive. When I was 21, I was about to 22. I was about to graduate from school. I had my senior thesis in my car. I was driving in the Pennsylvania mountains at 55, and the axle broke on my car. Wow. And the car started gyrating, and I thought I blew a tire. And I could tell the car was going to turn over. And I said, God, please save me. And the car turned over, and it spun around and around and around. It was compacted to 3 foot high. I looked at the pictures. There was no room for a person. The body was all folded around the seat. Thank God the seat was higher than my head. Wow. The tall seat.
Oh, my God.
And divine intervention saved me because a military service man came to my rescue and opened up the car door, and I was pinned by my hair. It got me unpinned, got me out, looked at my eyes, took my vitals, and I was fine.
Wow.
And the sheriff said, I thought no one was going to walk out of that car. I knew for sure you were dead. And he said, I've never seen anyone walk out of something like that. And I didn't go to the hospital. I had a mild concussion. I tried to do some math figures, and I looked at them the next week, and they were all wrong. So I had a mild concussion, but no loss of consciousness. And
that's the first one.
That was, no. That's just kind of in the middle.
That's in the middle.
But actually, acupuncture actually saved my life. There's something called an energy block that I wouldn't have believed. I grew up in a medical family. I read medical books for fun. My mom was a nurse, and I always loved to study. But I liked proof for everything, and I kind of poo-pooed my intuition. But this path helped me to really embrace my intuition and the value. But when I was in just school for my first year of acupuncture school, I was getting ready for work, and I looked in the mirror, and I said, I'm dying. There's no reason why you should hear that voice in your head that says I'm dying. And I had no color in my face, and I just felt so weak. And I checked my pulses, and my pulses were stronger on the right than on the left, which is odd. They're supposed to be stronger on the left than on the right, because the organs that are represented on the wrist on the left feed to the organs to the right. And I just happened to hear a conversation at school of people talking about Brian Bender, an acupuncturist who treats energy blocks. And I thought, I wonder if I have an energy block. It just came to my head. And he happened to be presenting at a time I could go. I was working full time, and usually I couldn't go to talks. But I went to his talk, and he had a woman in her mid-50s who had worked the night shift her whole adult life. And working the night shift will mess up your energy over time. And some people will get this block. It's the husband-wife block. And it kills people if your pulses are stronger on the right than on the left. And he did a diagnosis, or he did a evaluation in front of us so we could see how it was done. And she left the room, and he said, she's going to die if she doesn't get this block removed. And she came in, he removed the block, she felt great. And so I went into his office and I said, I think I have the husband-wife block. I think I'm dying.
Okay, why is the husband-wife block killing people? And I mean, I'm not going to say anything, but I'm married. I know it's hard, but I hope it's not killing me.
And I was single at the time. There's no excuse. I'm still single, but I had no excuse. But there are energy blocks. They're real, and acupuncture can heal it. So my acupuncture saved my life. And after that treatment, I felt such joy and love fill my heart that I'd never felt before.
And what do you think caused the block?
I asked him, what causes the block? And he said, sometimes if people have had some jolts in life that are pretty significant, or
trauma.
Or if they work the night shift all their life, which I never did, it can really mess up the body's energy.
And is it called the husband-wife block because we're talking about a bilateral balance? Is it preventing, like you said, the two sides from balancing, or?
I'm really not sure.
It sounds like
it.
it.
Husband-wife.
If you're talking about your pulse being stronger on one side than the other, it sounds like the husband-wife needs to be in balance, right?
It does sound like it. He practices a form of acupuncture I took a semester with, but I really have to go through the whole training. I think it's 2 more years of full-time training.
Wow.
It's a whole other system that I haven't studied. That's his specialty. So I'm really thankful that he chose that specialty, and I'm thankful that I met him so that I can help people.
And now you brought up lymphatic, the importance, and this is another thing that I love talking about because I think so few people know, let alone understand about the lymphatic system or how important it is. And I had a guest on recently that we talked about how sitting is the new smoking.
Yes, it just. We're going to listen to that podcast. It's good.
and so I'm so grateful that you brought up the lymphatic system because, again, it's an opportunity for me to help educate people, something that I think is so important, and it's our lymphatic system. Mm-hmm. If we don't help move that, stagnation happens, and that's it, kiddo. Mm-hmm. Right?
Yeah.
So maybe you can more intelligently say why that is.
Yeah, the Gallbladder Institute, I learned the lymphatic drainage massage technique, and he said to call it the lymphatic drainage. He didn't want us to call it massage because then people would expect a massage, because what it is just a gentle skin stretch. So he told us to call it
lymphatic drainage.
Yeah, just lymphatic drainage. And what the lymphatic system is so important, and it's all over our body, and the nodes are all over our body. The big 3 places where a lot of the nodes congregate are at the collarbones, in the armpits, and at the inguinal crease, the groin crease. Where, when you
and that's why the sitting is so bad. Because here, when we sit, that is at a right angle, cutting off the flow of the lymph and the energy in the groin, right?
Well, there's a lot of major lymph nodes there, and they taught us to stimulate the nodes first before we do the lymphatic drainage. Yeah, that's what he told us to call
drainage.
it. Drainage.
Oh, I like it. Not drainage.
Drainage.
Let's get a little French on there.
Right, exactly.
Drainage. Okay.
So you stimulate the lymph nodes at the clavicles, the collarbones, and the axillary, the armpits, and the inguinal crease, where your underwear meets your leg. And then you do a gentle skin stretch to help the lymph find its way to the big congregations of lymph nodes. There's no mechanical way inside our body for the lymph to drain,
right,
except for a gentle skin stretch. And it's less than a nickel's weight of pressure, so it's very, very minimal pressure. And we spent the first day just trying to get the pressure right.
I'm going to call it lymphatic massage for a minute.
Okay.
I love lymphatic massage, and I didn't know it was actually lymph drainage. But it is. If people have never experienced it, I think often, because most people go for massage and they're like, oh, I want deep tissue, because they want to feel like they're getting their money's worth or something.
Yeah.
When really, if you've ever experienced this very light pressure that you're talking about along the lymphatic system, it's so gentle and powerfully energetically shifting.
It is.
I think.
It's amazing. Everyone in class, half of us got a better night's sleep and were more soothed, and half of us felt more energized and didn't want to go to sleep.
Yeah.
So it's amazing what happens. And I was drawn to the Upledgers program because it was scientific. And I wanted to present something scientific to my patients, but I also learned it was very intuitive. On the first day of class, he had us feel a person's foot and draw a diagram of where the lymph was flowing. And I drew all these arrows around the foot that I thought I felt, and I looked at my teacher and I said, I have no idea what I'm doing. And she said, you know exactly what you're doing. You got the flow correct, and you haven't even taken the course. You're meant to be here.
That's awesome.
And so you can feel the lymphatic flow when you put your hands on a person's body. And if it's not flowing in the correct way, what you do is you help it flow the wrong way. Like it's
like a backflow device for my plumbing fans out there. It's a backflow device.
Yeah.
The lymph is the
and then
sludge.
It goes the right way.
We think, oh, my lymph are swollen, I have a cold. But we don't realize, no, the lymph is the waste elimination system. This is all draining into the intestine, right? Into the large intestine.
It carries a lot of
all the debris.
What we don't need, a lot of the debris. And for people with weak kidneys or kidney failure, they get a lot of swelling, and doctors have referred people to me who are too weak for Lasix. It would destroy their kidneys. And it really helps the swelling go down. And they're so grateful for this technique to help people who can't take the pharmaceuticals because it would destroy their kidneys.
And imagine even the healthy people might not need the Lasix. Did I say that?
Yeah, exactly.
Wait, so the healthy people could get the lymph drainage and avoid the Lasix.
Yeah.
What a thought.
Help the kidneys and the liver and the pancreas, help it. Yeah. What we found in class 2 was everyone had some misdirection of lymphatic flow. I had an old surgical scar where a cyst was taken out and the lymph flow was incorrect. And we all looked healthy, but everyone had some area of imbalance.
Blockage.
Yeah, some blockage. So by the end,
we wear bras and tight pants and belts, and
they brought that up. They're like, when you
synthetics
get home from work, take those stuff off, or
we should all be wearing muumuus, shouldn't we?
Don't wear them. It does hurt the lymphatic system.
It does, I know.
Yeah.
How about the cupping and the moxibustion? I don't know much about that.
The moxibustion, there's research on the kind I like to do is called tonetscu. Is when you roll ultra pure moxa, it's mugwort, Artemisia moss, into a size of a rice grain, and you put some burn cream on top of the acupuncture point that you want to put the tonetscu, and you set it on fire with some incense, and before it reaches the bottom of the cone of moxa, right before it hits the skin, you extinguish it. And what it does is it stimulates acupuncture points. It helps warm a person's body who's cold. It adds yang energy into a person's body. We need both yin and yang. We need both coolness and warmth, both calmness and energy in our body for a healthy body. It also has been shown to change tissue configuration. So people with low back pain or people with pain in their knees, I'll burn some moxa on those areas, and it actually changes the tissue configuration if you do at least 10 cones of moxibustion.
It's very wizardly strange.
It seems
how
wizardly.
In God's name did they figure this out? What? Who? How? Why? I don't. I mean, I've had it done because I try everything. I try everything. I want to know,
Yeah.
But how in the world? Like, what? This is an ancient technique. How did they figure that out? Do you think?
I'm so thankful they did.
Yeah. Right.
Yeah.
Well, it had to be intuition.
Yeah, I don't know. That's a good question.
Right.
Yeah.
And so you're using a specific herbs actually in the cupping. Are those the same herbs you're sending a patient home with?
Okay, in the Moxibustion, no. The Ultra Pure Moxa that I purchased, it's very, very expensive. It's $100 for just a very, very small amount.
There's no fluoride in it.
No, I want to use the best.
Totally off topic, but I'm into this. Everything is now tainted with fluoride because fluoride's in all the water. So all your teas, all your herbs, everything. It's hard to find pure anything.
No, and it's a toxin.
It is very much a toxin.
Yeah, our body doesn't need it. Yeah, we studied that. My dentist still doesn't believe me.
Oh, my dentist knows. I send Harvard double-blind studies.
Wonderful.
Yeah. They used it in Auschwitz, I think, in the concentration, in some of the concentration camps. They used fluoride. Isn't that scary? And we put it in our water. Anyway, I really believe all the things that we've done out of a thought that it actually would benefit. I don't think there's such dark force. Well, I'm sure they really believe that fluoride in the water was, there goes the train, was going to help.
Nice.
I don't think they thought they were calcifying everybody's pineal glands and slowly turning everybody into chemical
and that's what
zombies.
That's what I noticed having relatives in the medical field where they thought this drug was the best thing, and then, oh my God, no, it causes birth defects, and so I've learned as a child to always keep an open mind because we never know, and so that's why I put a lot of confidence in the 5,000-year-old medicine with longitudinal research that's tried and true. I mean, they were doing longitudinal studies when they weren't studies. I mean, they were observing. They were putting little pieces of bone or little pieces of metal on acupuncture points and seeing how it affected the body over time. And they came up with this amazingly complex system. It's a lifetime of study. I study every week. I study every day this medicine, and I love it. So complex. So I thought I did entertain being a Western doctor, and I decided that my personality is more suited for Eastern, and I really like to rely on the 5,000-year-old wisdom. I really honor
You've got
the
both, though, because you've got the perfectionism, which is very Western.
Yeah,
you've got the demand for scientific evidence, which is very Western.
That's true.
And I think it's just your openness and your strength and intuitiveness that makes you very Eastern. So back to the herbs. How do you get good herbs? How do you get pure stuff?
The herbs from Japan are of the highest quality, and
they're not fluoridating their water.
No, they have rigorous standards for their herbs and purity, and the places where I buy my herbs, there's outside people coming in and looking at how they're operating, and they give them a what do you call it?
Sort of certification, standardization.
Yeah, they give them an audit and give purity standards for their herbs, and the herbs that I use are very pure, and I do trust products from Japan.
I just want to interject real quick before I forget. If anybody has any questions or complaints or concerns, or you're just bored and you want to communicate with us, we'd love it. You can email us at feedback@thorpeinstitute.com. I'm Lisa Thorpe. So Thorpe Institute is one of my companies. You can reach us, and we love your feedback at feedback@thorpeinstitute.com. And Mikaila, what else do you want to share with everybody before we wrap up?
Oh, well, the cupping. People come to me for cupping, and what that does, what you do in cupping is you get octopus hickeys on your back.
Yay. So. I've never heard it put that way. Octopus hickeys.
So you don't want to do it right before you're going to an event where you need to wear an evening
backless
gown.
dress, right?
Or you don't want to do it right before you're going surfing.
Or in the sun, right?
Yeah, or in the cold. So you have to come for cupping at a time where it's okay for people to see those octopus hickeys, and where you won't be exposed to the elements too. What it is you take a glass cup and you put an alcohol-saturated cotton ball inside the cup. you set the cotton ball on fire inside the cup, and then you place it on the person's skin, and it creates a vacuum, and it helps with blood circulation, and people say it helps pull out toxins. And what I find it very useful for is when people have back pain or any type of phlegm in the lungs that's just not leaving. I have a lot of success with that. I put it in the middle of the scapula and go down I do a front and back treatment when I work with people. The back points are very nurturing and help really build up the strength of the body. So for me, it's essential to always do a back treatment on my patients, and I'll slide the cups down all the back points to help all the organ systems and to help the muscles relax. And I get even better results when I add the cupping. Insurance doesn't reimburse for cupping. I don't think they quite understand it.
Insurance doesn't understand detoxification yet. There's really the functional medicine is really, I think, leading the way for Western medicine on the importance of detoxification. Mm-hmm. Obviously, Eastern medicine has gotten it for a while that we have to help the body remove toxin or eliminate toxins, and especially nowadays, right? Mm-hmm. It's a bigger issue. I think for most people, the cupping and the moxibustion are, well, maybe the needles too, but they're just things that they're afraid to go in for because they think it's going to hurt or they think it's going to burn or it's just weird. But hopefully just hearing about the process, because I do think, not knowing is always the scariest part, but if you understand, then it's not scary.
Exactly, yeah. In my mid-30s, I started to get knee pain, and I burned some moxa on my knee, and it hasn't hurt since.
There you go.
So
pulled it out. Yeah.
So it's been like 13 years later, no knee pain. And when my patients start to hurt, I burn the moxa on, and patient in his 70s, he hasn't had any knee pain since I did it just once. There's no guarantees, but everyone heals differently. So people start to ask for things. Like, aren't you going to do the cupping? Can I have the cupping, please? Are you going to do some Moxibustion? Can you?
And you said something else that I think is really important, which is it's not just about not showing the spots on the back from the cupping. When you're in a healing phase, and I talk with people that come to us about this, when you have something that's saying it needs healing, you need to take time to heal. Right?
You do, yeah.
If you can't go in for a therapy and then go out the next night and work all weekend and think, oh, it didn't work, or I'm not getting better. When your body is saying something's up, take time to heal. I always say that. Take time to heal, or the healing is going to take time. It's just not. It's not going to heal if you don't take the time to heal.
And sometimes we get really sick, so we can take time.
Right.
But the elements also get us sick. Like, I noticed an increase of people in the clinic when it's really hot and there's heat in their lungs. Or after the fires, people coming in, there's heat in their lungs. It's very real.
Oh, so the smoke.
You do the points to help nurture the lungs and help let the heat out.
And I would imagine
it works.
Even the fear of something like that going on builds up in the system.
Yeah, one thing I like about Chinese medicine is that they don't separate psychological health, spiritual health with physiological or physical health. It's all, the points are the same. The points treat spiritual, mental, and physical. They're not separated. They all work together.
And I think,
affects the other.
If for people that don't believe in a spiritual existence, I think we can all agree that energy is real. That everything is energy, and that
That's
you have
true.
a positive or a negative energy. At least that's the way I bridge the gap between spiritual and non-spiritual.
And there's physiological processes that happen.
Right.
So
I love everything that you're doing. I think people are very fortunate to come to you if they have an opportunity, because you've got such a huge toolbox. And you're over in Poway. How far? We're in Encinitas. How far are you?
I think it took me 20 minutes to get here.
It's pretty close.
Yeah, 20. Yeah, on a weekend it can take me 20 minutes to get here. But during rush hour, that's something else. That depends on the traffic.
I know. I call it LA trickle down.
Yeah.
We've got LA traffic here now because everybody wants to live here. It's so beautiful.
It is. It's gorgeous.
Yeah.
I love this part of town. Yeah.
Awesome. Well, Mikaila, it has been such a pleasure and an honor having you here.
Thank you.
Just a wealth of knowledge, and I hope we have an opportunity to talk again on the show. And is there anything else you want to share before we wrap up?
No, just thanks for having me. I appreciate you having me here. I'm very honored to be here. Thank you very much.
It's all good. We're having a good time doing it. Yeah. All right, awesome. Thank you so much. This is Lisa Thorpe with Health and Wellness and Sanitas. Check us out. Have a great day.